like falling cases, percent of COVID hospital beds that are available. Questions like, is that number flat or is it falling? And whether or not we've got falling positive test rates. Dr. J will go into that with a little more detail in a moment. We won't lift all of our protocols at once. We will do it in a measured way so we don't undo the progress that we've made. So, with recent daily case counts averaging well above 6,000 a day, the daily death toll reaching over 100 a day, and the risk of hospitals being overwhelmed, right now we've got to join forces and double down on what it's going to take to get these COVID numbers down. This may be the most difficult time in our whole struggle with COVID-19 since March, especially with the holidays approaching. We are on the brink of incredible breakthroughs when it comes to vaccines. We are closer than ever to the day that we begin distributing an effective and safe vaccine. And we've got to all do our part to protect one another until we eliminate COVID-19 once and for all. It's imperative that we protect one another by doing the things we know to do. Wearing a mask, practicing social distancing, so that we can return to a strong economy and normal day-to-day activities. The epidemic order in place now is aimed at 1, limiting indoor gatherings, 2, gatherings that have people of different households, and gatherings where people come together without wearing masks. That's just simply how COVID-19 transmits from one person to another. The science here is settled. The best way we can protect our frontline workers and slow the spread of this virus is to double down on mask wearing, social distancing, and limiting indoor gatherings where people are at most at risk of transmission. Now, there is overwhelming research and scientific data that says going to locations that offer on-site eating and drinking options is associated with COVID-19 positivity. There are studies after studies that show this. We will have a link to them on social media in case you're interested in reading them. Adults with positive COVID tests were approximately twice as likely to have reported dining at a restaurant than those who were negative. It's not anyone's fault. It's not the restaurant's fault. It's not my fault. It's not Dr. J's fault or Director Gordon's fault. This is how COVID-19 spreads. It's just that simple. It's the science of the virus. And that's why we've got to limit indoor gatherings, where people come together from different households, stay together and not wear their masks. Now I want to speak to the Michigan legislature. My administration has been working hard to fight this virus, but we can't do it alone. This year we have taken strong bipartisan action to get a number of things done for the people of Michigan. We passed 2 bipartisan budgets that include crucial funding for our state. We worked together to extend unemployment benefits until the end of next year. And now we've got to partner to eradicate this virus and to protect those we serve. Last month, I sent a letter to the legislature urging them to work with me on 3 key priorities during the few remaining session days that are left of 2020. Number 1 is passing $100 million of COVID relief funds that will provide direct financial support to the families and small businesses that have been hit hardest by this pandemic. Also, passing a permanent extension of the unemployment benefits so thousands of Michiganders don't lose their benefits at the end of this year. And passing legislation to protect public health, including bills to require that people wear masks. This has got bipartisan support in the legislature. I think if we codified it, it would go a long way toward encouraging greater compliance. So let's join forces. Let's do what we know works. Let's help people get through this tough time. It will not last forever, but right now is a very serious moment. While DHHS extends this pause, it is my hope that the legislature and our federal government will help me develop the path to help the unemployed workers and the businesses who are struggling. This has been a long, tough fight, but let's not forget our history. Our brave soldiers fought to keep the Union together during the Civil War. We came together in Detroit, Michigan as the arsenal of democracy to defeat the Nazis because we stood united against a common enemy. We made it through the Great Recession and the auto rescue. We can beat and eradicate COVID-19. We have flattened the curve once. We can do it again, and we must do it again together. Before I hand it over to Dr. Khaldun, I want to end by discussing the recent threats against the Secretary of State, Jocelyn Benson, Representative Cynthia Johnson, and House Speaker Lee Chatfield. Yesterday, we learned that dozens of protesters gathered outside of Secretary Benson's house as she was finishing putting up Christmas decorations with her 4-year-old son. Representative Cynthia Johnson shared voicemails containing death threats after last week's hearing with Rudy Giuliani. And Speaker Chatfield said that threats have been made against him and his family. This is unacceptable. Threats against our elected officials or any office holder, no matter their party, are not acceptable. They are unlawful and they are unacceptable. Hate and violence have no place in Michigan. Secretary Benson has worked 24 hours, 7 days a week to ensure a safe, fair election in Michigan. The people spoke, and it's time to put the election behind us. And it's time for us to come together against our common enemy, the virus known as COVID-19. I ask for people of goodwill in all parts of our state, on all sides of the aisle, to come together. Let's rise to this challenge and do it together, protecting one another and getting through this all together. Thank you, and with that, I'll hand it over to Dr. Khaldun.
Thank you, Governor. Good afternoon, everyone. While there are some signs that things may be improving, we are clearly still in the midst of our second surge of COVID-19 in Michigan. Our case rate is now at 522 cases per million people. It has been trending down in the past 16 days, but is still alarmingly high. We are more than 7 times the rate we saw at the beginning of September. Case rates range between 428 cases per million in the Traverse City region to 603 in the Jackson region. Percent positivity is also one of the important measures that we look at. Percent positivity is important because it tells us if we might be missing cases, and it is an indicator of how much community spread is happening. Right now, our percent positivity is 14.1%. That is more than 4 times where we were at the beginning of September. Positivity had been declining, but in the last week, it increased. Positivity ranges from 8.1% in the UP to 16.1% in the Saginaw region. We will continue to track this in determining how well we are containing the disease. Overall, growth in hospitalizations has slowed over the past week. While it varies by region, about 19% of hospital beds have COVID-19 patients in them. We continue to work with our hospital systems to help them implement their surge plans. It's important that our hospitals be able to take care of not just COVID patients, but non-COVID patients as well. Unfortunately, we are now seeing over 100 deaths a day on some days, more than 7 times the number of deaths we saw in early October. We know the way this virus works. Someone gets infected, then they have a positive test, and then hospitalizations rise. And after that, we know that some people will unfortunately lose their battle with COVID-19.
This douchebag just said that we're going to be in lockdown for another 12 days.
Time for us to see as the virus spreads. And we know that some metrics will change sooner than others. We will continue to look at these metrics as we track the spread of the virus in Michigan. I worked a shift in the critical care area of the ER this past weekend. I can tell you that this virus is real. People are still coming into ERs, even weeks after they have been diagnosed, with complications from this virus. We need to take this seriously and do what we can to prevent spread. As I've said earlier, I'm excited that vaccines are on the way. This is the most important tool we have to eradicate this virus and end this pandemic. There are 2 vaccines that are currently moving through the approval process with the FDA, and we expect both of them to potentially be available as early as this month. The process for developing these vaccines is based on evidence and science, and no steps have been skipped. The vaccines will only be available when the data has been reviewed by expert scientists and doctors. There are currently over 280 locations across the state that have enrolled in the state's vaccination program, and they are located all over the state. While the vaccine initially will only be available in limited doses, in the next several months, as more and more becomes available, eventually most adults will be able to get the vaccine. One of the most important things every adult should be doing right now is planning for how they will get the vaccine when it becomes available to them. And you should know what to expect. For the 2 vaccines that will be available potentially this month, you will need not just 1, but 2 shots. This is necessary so that the vaccine is effective, and timing depends on which vaccine you get. The Pfizer vaccine requires you to get a second shot 3 weeks after the first, and the Moderna vaccine requires you to get one 4 weeks after the first. You should also understand the way the vaccines work. They don't actually give you the disease. They prepare your body so that it is ready to fight if it comes into contact with the real virus. The mild response that you may get after getting a vaccine, things like a low-grade fever or a sore arm or feeling a little tired, those are actually good signs. That means that the vaccine is working, and it means that your body is preparing to fight this virus off if it comes into contact with it. This is just the simple science of how vaccines work.
This lady's fucking crazy.
Know the facts about vaccines and the process for how they are being developed. And please check our website frequently for more information. You can go to www.michigan.gov/COVID vaccine. When a vaccine is approved, information about the specific vaccines will be available there as well. Overall, I am very hopeful. While I'm concerned about our very high case rate and our hospitalizations, and our positivity rates remain alarmingly high, we have the tools we need to fight this pandemic.
Just so everyone's aware, if you want to wear a mask, good for you. I don't think there's anything wrong with wearing a mask. If it's going to make you feel better, make you feel safe, it's totally fine. These people are crazy, though. They're going to make me go to the hospitals and go live. I'll be the cameraman for the first time to show y'all these hospitals are not overrun. These people are just crazy and brainwashing everybody.
Information about vaccines. We are almost there. 2021 will be the year when Michigan beats back this pandemic, and we just have to stay the course. With that, I will turn it over to MDHHS Director Robert Gordon.
This guy's like Zuckerberg's cousin or something. He's weirdo. Look at this guy.
And good afternoon. As Governor Whitmer and Dr. Calhoun have said, we've achieved some progress. We're listening to our hospitals, and the progress is not enough to begin restarting. But it is enough to write a shorter renewal and to see the consequences from Thanksgiving. I'm going to talk now about the improvements we're looking for, why we're looking for them, and what we'll do if we see them. We're looking for progress on 3 measures that Dr. Calhoun already discussed. Each does some work. First, the percent of hospital beds filled with COVID patients. The higher that number, the less room for people who need care, and the more risk they won't get quality care. We want to see that number flattening or coming down. As Dr. Caldoun said, we have seen that percentage flatten in the last week, and that's good. We want to see continued progress. We'll consult with Michigan hospital leaders as we consider this metric. Now to the second. There's a lag between when people get infected and when they get hospitalized. If we only focus on hospitalizations staying flat, we may miss that COVID is growing. By the time hospitalizations are rising,
Just so you guys know, the volume is maxed out. They're no better than anyone else. Here in Lansing, they don't know how to use audio gear either. I'm sorry, everything's maxed out. I can't turn it up anymore.
we want that trend to meaningfully continue. Fewer infections generally means fewer hospitalizations. Now to the third metric. We want cases to go down because there's less COVID in the community. That's what we want. But cases can also go down because there's less testing. That's not what we want. So we look at the percentage of cases that are positive. If that percentage is going down, it tells us we're finding more of the COVID in the community, and that's good. The positivity number is not declining right now, but we very much hope that it will. So that's what we're looking for. Flat or declining hospitalizations, fewer cases, lower positivity. Let me be clear, there's no formula. These numbers don't capture some things that matter, like the age of people getting sick or the mix of tests being measured. You don't ask your doctor to judge your health by a formula. You don't judge your family's financial well-being by one formula. Michigan lives are too important to use a faulty formula. But we will be reviewing these data, and we will be transparent with the public about exactly what we are seeing. Now I want to talk about next steps if we do see enough progress. One thing we've learned is that progress against COVID is hard to earn and easy to lose. We need to reopen cautiously, not recklessly. So the first thing we look next to do is to give local communities the ability to reopen high schools because of their unique value for kids, for families, for our future. Among some small adjustments, today's order allows career and technical programs to resume in-person, hands-on instruction under rigorous protocols required by MIOSHA. Now, this order, as Governor Whitmer explained, closes indoor settings where people gather without masks, notably indoor bars and dining, and where they gather in groups, including theaters, bowling alleys, casinos, group fitness. This is because of the settled science that COVID spreads most easily when individuals are indoors, in groups, and unmasked. As we look to open further, the right next step is to open indoor venues that individuals can be in while still consistently masked. This means that in the next phase, we'll open settings such as movie theaters, bowling alleys, and casinos, provided that concessions with food and drink are closed. Concessions need to stay closed because if they're open, individuals are eating and drinking unmasked together. The science on eating and drinking inside is settled. As Governor Whitmer said, there's a lot of studies on this, and I'll name just one recent one. While inside a restaurant, 2 people got COVID infections from an individual who was 15 to 20 feet away, in one case for just 5 minutes. That finding mirrors a raft of studies finding a correlation between restaurant traffic and infection levels. This is why the debate over one person at a hearing is a little bit beside the point. That hearing, like others, was an indoor gathering with unmasked individuals close to each other. Michigan now has hundreds of thousands of people with COVID. So apart from one person, there was a good chance that one or more people in that room had COVID. Whatever our politics, whatever the purpose, a long unmasked indoor gathering risks lives and hurts the businesses that want to open safely. Please, if you are inside with someone from outside your household, please always, always wear your mask. If progress continues, we will eagerly reopen venues beyond those I've described. We're not ready to do that now, and it's unlikely we'll be ready to do so in 12 days, but we will do so as soon as we can. Let me end with two more measures that aren't official criteria for reopening, but that should matter a lot to all of us. The first is mobility. How much are people moving around? The less people are in motion across households and into other households, the less we are going to see COVID continue to spread. This is a metric that's been going in the right direction, and that's a good thing for all of us in Michigan. And the final metric I want to mention, as the governor and Dr. Khaldun spoke about, is deaths. We have seen a surge in deaths. Each life lost is precious and irreplaceable. With the steps we are taking today and with the actions that all of us take, we can give thousands more Michiganders the chance to enjoy the next holiday season. For this holiday season, let's mask up, let's avoid indoor gatherings, and let's give the gift of life. Thanks.
Thank you, Dr. Khaldun and Director Gordon. With that, I am happy to open it up for some questions, and certainly Director Gordon and Dr. Khaldun are here as well and can answer questions directed to them. So feel free.
Governor, the first question comes from Rick.
Yes, did you call on me? I'm sorry, I couldn't hear you.
Yeah, she did, Rick. Go ahead.
All right, thank you. Governor, I got 1,000 things I want to talk to you about, but I'll try to keep it to this. I just heard the doctor talking about that 12 days won't be enough to reopen some of these things either. I mean, are we already to that point that we're extending by 12 days, but this isn't going to be enough to start opening some of these businesses again?
I can certainly ask, was it Dr. J or Director Gordon?
I'm sorry, the director, I'm sorry.
Okay, I believe what he was communicating was that if the numbers in these areas that he articulated are going down, and in the judgment of our medical professionals, we can start to re-engage some things, we will do so, but that it will be in a methodical way, not just all in one fell swoop. But, Director Gordon, did I get it? Okay, that's what he was communicating, so appreciate the clarification. Rick.
Okay, Governor, the next question will come from Kathy Gray with the New York Times.
Good afternoon, Governor. I'm wondering when the logistics, the state plan for distributing the vaccines is going to be put out, as far as like who gets it, when they get it, that type of thing.
Yep, I am going to let Dr. Khaldun answer that one, Kathy.
So yes, we are spending 24/7 these days working on our distribution plan, working with a lot of different stakeholders to determine when the vaccine comes, who's going to get it, what hospitals are going to get it. So right now, there's still a lot of things that are uncertain. We actually don't know the actual amount that we will receive when a vaccine is approved. But I can tell you we now have, again, over 280 providers across the state who have already signed up to be a part of our vaccination program. We do know that in the beginning, again, according to what the CDC and other experts have already said, we will be prioritizing frontline healthcare workers, and we're already working with hospitals and local health departments on that plan.
Okay, the next question will come from Tim Skubic.
Governor, are there any signs that you are close to a deal with the legislature on the jobless benefits and the other issues, or have you had no talks at all, ma'am?
And there's nowhere in between, Tim. You know, I have had a few conversations. I have talked with the speaker. I have chatted with Senator Stamas. We've raised it in our quadrant meeting last week. I know that there are a lot of conversations happening amongst the four caucuses as well. So I am hopeful that we can get it at the very least extended beyond the end of the calendar year. I would like to see it extended indefinitely. I think that the change that happened under my predecessor, I never agreed with that, and I would like to see that eliminated, the restrictions on unemployment, but regardless, we've got to get this extension beyond the end of this calendar year done so that on the first of the year, people aren't absolutely struggling to just get by.
Okay, Governor, we'll go to Kim Russell with T7 in Detroit.
Hello, Governor. We're hearing from business owners who say the next 3 weeks typically are 20 to 30% of their income. What are you proposing to the legislature or to Congress for these business owners so that we don't lose thousands?
I have the chart pulled up from the CDC, and we're going to take a look at it when she's done speaking, because there hasn't been a single flu death all year, but it's right next to last year's, the years before, and the year before. You'll see.
And businesses that are places where people come together inside from different households and remove their masks, like places where you eat or drink in particular, are uniquely at risk in this moment. And it's not the restaurant's fault, it's not the bar's fault, it's not our fault, it's just the nature of COVID-19. Now, we got a couple of tough months ahead of us. We know this because we've been listening to the experts. We know this because at every step of the way, the epidemiologists, the public health experts, Dr. J, all of the team that are these brilliant minds around public health and epidemiology has been telling us this fall is going to be hard because it's the convergence of flu season and coming inside when the weather plummets. We have been saying that this was going to be a trying time, and it is. It truly is, as we see what's going on with our hospitalizations and our medical workforce. This is a tough moment. We're going to have a couple of tough months, and then we're going to see vaccines that are more and more available, and more people are going to get vaccinated. We've got a lot of work to do on that space. But this is real progress that we are on the cusp of. But we can't stop fighting in the next couple of months. We have got to get our numbers down and keep them down. And so we need to help these businesses, and that's what I'm trying to do. I want to help the unemployed through an extension of unemployment and through $100 million here at the state level that I've asked the legislature to get done. It would go to unemployed persons. It would go to businesses that are struggling. I also know that having spoken with Speaker Pelosi last Friday, a number of my colleagues and I, fellow governors from the Midwest, talked with the Speaker. She indicated that conversations with Senator McConnell in the White House were productive. It is my hope, there's no text yet for all of us to scrutinize, but it is my hope that they get something meaningful done that will help states and help locals, that will give us additional ability to help these businesses and these unemployed people. And that's why we all have to be a part of the solution here. Individuals have to do our job to wear our masks, keep COVID from spreading. The federal government has a job to do. State government has a job to do. We've all got to be in this together. And we get through these next couple of months, we're going to be in a much stronger position. But we got work to do right now, and that's where we need more partnership from the Michigan legislature, from Congress, and from the people of Michigan.
Wow. Thank you so much, WiseMD, for your very generous donation. I really appreciate you. You're awesome.
Good afternoon, Governor. I just wanted to ask, Kathy kind of took part of my question, but when we do get the vaccine, what is the timeline for when we will see the impact, since we've been talking about 14 days since an event where we'll see an impact? Will it be more sudden than that? And then I also wanted to just touch on the hearing last week. We've been getting mixed signals from different health departments and the CDC. What should the people that were in that hearing room be doing?
Okay, so Eric, both of these questions I think are questions that Dr. J can shed some light on. I'll just say this. Our job is to get prepared so that we can distribute and administer vaccines when they are available. They haven't been approved yet, much less made available. Numbers of vaccines that we anticipate may not end up being what we get, similar to PPE and testing as we've been dealing with for the last 8 months. But we're going to be nimble and we're going to be ready. So when they come, we're able to make sure that we're getting people vaccinated. With regard to the timeline question, I'm going to ask Dr. J to answer, and then on the question of people that were at that hearing, she can as well, and I may add a few thoughts after she's done on that one.
All right, so both good questions. So for the vaccine, what we know is that in the very beginning, we will have a very limited supply. And so unfortunately, we will have to prioritize in the very beginning. Again, early on, frontline healthcare workers, and then we'll expand out to those who are more vulnerable. And then we hope that by late spring, the vaccine will be available for the general public. But what that means is that it will take some time for everyone to get that vaccine. And we do hope that people are learning more and more about it every day, looking at our website as I said.
Did you guys know that Canada's rolling out their vaccine today? I don't know if you're able to get it, but as far as I know, their military is being dispersed right now to pass out their vaccine. And I think it's interesting because they still act like there is no vaccine for us. They're like, oh, well, we're still developing it. Well, they're rolling theirs out today, and I don't think they have a choice. I think they have to take it. This stuff is crazy. This is exactly what they did in the Holocaust. It just wasn't about this nonsense. It was manipulating the public for the greater good. If you don't believe me, read about it. I can't hold your hand through it.
At least from media reports about when Mr. Giuliani may have come down with symptoms or when he may have been tested, essentially people who were at that hearing on December 2nd, they should be quarantining through December 12th. That is 10 days after their last contact with him, particularly people who were within 6 feet of Mr. Giuliani. So that is, again, based on CDC guidance.
And the only thing that I would add is, that hearing last week was reckless, and it was unnecessary. It didn't change a thing, and yet it brought all of these people into a room, many of whom did not wear masks. They were there for over 4 hours, and enclosed. This is exactly what we're talking about when we highlight the different ingredients for a potential super spreader event. And it did no good for our state. It didn't change any outcomes. It didn't shed any light on anything. It was just simply reckless. And it is actions like this that threaten our ability to open up some of these businesses. When people aren't doing what they can do and need to do to keep others safe and to keep COVID down, that's what undermines all of the work we're trying to do to protect our hospitals and our healthcare workers and our families and our businesses. If everyone takes this seriously and does their part, we're going to be in a much stronger position. We're going to be in a better position to re-engage some things. But right now is a precarious moment, and it was a reckless thing to do last week.
Okay, Governor, the next question will come from Emily with MLive.
Hi, Governor. You spoke about gradually reopening some of these industries when the restrictions do lessen. It sounds like restaurants might be on the back end of that. I'm wondering where high school sports fall, and if there is any hope that some of those fall sports can finish their seasons.
Well, I may hand this over to Director Gordon, but prior to doing so, as a parent of a high schooler, I believe, and as the governor of Michigan, I believe, that our first priority should be getting students back in the classroom safely. That, I believe, is paramount. But I will hand it over to Director Gordon to talk a little bit more about how that re-engagement might look.
Yeah, just to add to what the governor said, the first priority is reopening high schools for education and sustaining that. I think when it comes to sports, there's a range of risk levels. And so at one end, you have kids, individual activities that are outdoors and where people are spaced out. At another level, you have contact sports outdoors. At another level, you have indoor contact sports. And as you go through those levels, the level of risk increases, and we have to think carefully about moving through them. So I will just leave it where the governor did, that our first priority, and also lower risk than a lot of those activities is getting the schools open for education.
Okay, Governor, the last question will come from Ben with Home TV.
Hello, Governor. First question, I just wanted to ask, this goes for 12 more days, but Christmas is, I believe, 6 days after that, and that's usually a time where more people are moving around and going to visit family members. So if you decide that to re-engage slowly, would you really be taking into account that Christmas and New Year's are coming? And I'm also just curious as to where colleges fall on that re-engagement list.
Okay, let me say something first and just be very clear about this. No matter what we show in the next 12 days, I am discouraging people from gathering for Christmas. It doesn't mean we cancel Christmas. It means we celebrate in a responsible way, and we make our plan now to do that. If our numbers come down a good amount, it still doesn't mean that COVID is gone by Christmas. And so in order to make sure that next year's celebration can be like last year's, where we have everyone together, this year's has to be smart. This year's has to be celebrating at home with the people with whom you live and taking efforts to stay connected to your family in other ways. So regardless of when the 12 days, what we see, that remains the safest thing to do, is to celebrate Christmas apart and find different ways to be together in spirit and emotionally connected. That's important. I don't want anyone to think that I minimize that's hard to do, but it's absolutely essential this year that we do that. With regard to additional activities that could, I think, be engaged in 12 days, depending on what the numbers are. I know that Director Gordon articulated what those are. I think that we will have to look at this as incremental, simply the re-engagement, like how we did in the spring. When we did it that way, we kept from having, I talked about it being more of a dial than a switch you turn on and off. That's how we kept our numbers from growing exponentially when we re-engaged. That's what we need to do now, again, as we contemplate doing more things that we're not doing right now. But I think it's important for people to know, we are seeing a lot of states and countries go into stay-home orders. We are not in one. We've pulled back on some things to try to get these numbers down, things that we know are inherently more risky. But we are not in a stay-home order. We still, by and large, can conduct a lot of our lives the way that we're used to doing it. We're just trying to be really targeted and temporary to get our arms around the spread of COVID, to keep people safe, and to support our businesses, to keep these numbers from growing so big that we have to take more steps back. So please, everyone, do your part. Make your plans. Know that this spring there is so much hope on the horizon. But let's hunker down for the next, weeks and months, get through this, and get through it together.
Thank you, everybody.
Thank you.
Goodness. What a bunch
12
of
more
nonsense.
days,
All right, you
ladies
guys
and
want to see
gentlemen.
these graphs that they're all
We are
pulling
now
their
at
information
December
from?
20th. Thank you for joining us here at the Wood TV Live Desk. If you're still watching, my name is
for
Luke
those- well,
Laster.
let's see if I
Again,
can
here
find
from
my
the Wood
mouse
TV
here.
Live Desk. All the information you just heard can be found over at woodtv.com. So,
All
at
right.
this time, I do want to
should be
say
able to
one
see
more
my
time, and I'll
mouse.
say it a
You
few
should be
more
able to hear
times.
me. This
12
is the
more
CDC
days as
website.
that epidemic order has been
Refresh the
extended
page, just in case
through
you think I'm doing some
December
CNN stuff. There
20th.
ain't no
So,
doctor,
I'm going to
nothing
create a
here.
poll now so you can have some opportunity to interact here. I'll
Okay,
take
I've
this
refreshed
other
it
image.
twice.
Again, this is the orders
This
from
is
the MDHHS.
influenza
That's paused to
area
save
of their
lives
website.
epidemic order of what is
So this is
open
all
and
the
what is not
information
open.
on
We're
it
going to go
stuff.
over a
And as we
couple of
scroll
things
down, we
here.
can
I
see
have a
the
poll.
graphs.
Are you okay with the 12-day
Moving
extension of
right
the epidemic
along
order?
here.
Yes or no?
So-
You know how to vote. I'm going to create the poll.
Don't know
It
if you can
is
see this,
going to
but
be
this blue
published. All right,
It's
you should be
COVID.
able to see that on your
Okay,
screen.
this is
So,
2020
the Michigan
right
Department
here.
of Health and Human Services
the COVID
has
line.
extended
This
by 12
yellow
days the
is
epidemic
the
order
flu.
that restricts indoor social
flu
gatherings
deaths.
and other group activities. The
COVID
additional
deaths.
12
Okay.
days will allow the
You guys are
department to
still with me.
determine the full impact
So as we
of
scroll
the
down
Thanksgiving
here,
holiday on the spread of
you
COVID-19
should be able to
across
see
Michigan. And as we know, it
this
does take a
green
while
chunk
for
right
that
here is
virus to
deaths from
activate
flu,
inside of us. And so
2017,
it is
2018.
about 2
This
weeks,
is
I
death
believe, on
from the flu,
Thursday, and that is
2018,
some
2019.
concern
You can
that
see the
Governor
deaths here,
Whitmer expressed
185,
with
144
the
number
spread of the
deaths
virus.
from
Under today's
2019 to
orders,
2020.
MDHHS continues to urge
196.
families to
Now,
avoid
this is the weird
indoor
part. Let me
gatherings,
just
and
get my
only
face out of
2
the way
households
here.
may gather inside with strict protocols recommended. Again, this is
Where
from
is
the
the
MDHHS.
deaths
Thank you again for voting in that poll.
for
I'm seeing a lot of early
2020?
numbers here come in, and I do
Why
want to
is
say,
there
as a
no
matter of fact,
deaths?
if you do look on the bottom of your
There's
screen
not
there,
been
you see
one
that
person to
hashtag there,
kick the
hashtag
bucket
Hey
from the
Luke.
flu. This
If you
is
want
the
to voice
CDC
your
website.
opinion on what you
Like,
thought
this is
of the governor's
like
press conference there,
this
she's
is
joined
their
by a
source
couple
of
others. Use
information.
that hashtag there. I'll be able to see it, hopefully, and pull it
Look at
up
what
on the
COVID's doing.
screen.
No more
Again, if
flu.
you're just joining us at
We
the
don't have the
12-day
flu.
extension, you can see it over all on woodtv.com. That pauses
Like,
save lives. That'll be going there another 12 days. Gyms are open for individual exercise with mandatory masking and additional.
My bad, everyone. I did not realize he was talking. How dare he speak over me? Oh, I lost it. Just a moment. What a bunch of nonsense. What a bunch of nonsense. Just a moment. Alright, you should be able to actually watch me walk through this. So once again, we're back here on the CDC website. And you guys can look this up. You don't have to take my word for it. Okay, this is influenza from the CDC, right? Go to flu activity and surveillance. Keep it scrolling, keep it scrolling. I bet I could actually make this really big so you can read it. Alright, now I just gotta get my face out of the way. So again, as we scroll down, yellow spots, flu death. Gray spots, COVID death. Okay, 2017, if you can see my mouse here, 2018, 2019, 2020. Okay, now I'm not like a real smart man, okay, but these people make me feel real smart, and that's a big flag. So as we move down here, this is flu death from 2017 to 2018. 188 deaths. Flu death, 2018, 2019, 144 deaths. 2019, 2020, 195 deaths, right? That's the most people to kick the bucket from the flu in the last 3 years. 2020, 0. Not one person has kicked the bucket from the flu all year. Hasn't happened. We ain't got that much longer left of the year. No way we're going to hit that number. Like, what kind of sense does that make? This is where they get the information from to make decisions based on COVID. So how many of these deaths are flu related? How many of these deaths are pneumonia related? We all talk about this. We all know how it goes. We all know how it goes. But this is their information. This isn't my information. This isn't what I went and found. Like guys, look what I put together based off, like CNN. We took a poll. This is what everybody came up with. No, this is not that. This is their information. This is why they hate me at work. It's because I throw this in their face every time they try to take my rights away. It's messed up. It's messed up. I should pull the Holocaust stuff up here because I think you guys would be surprised at all the similarities. Most of the people got on the trains willingly because they thought it was for the greater good. People were having their children sign up to be Gestapo and SS soldiers because they thought they should be proud. The brainwashing is real, and they didn't have Facebook back then. They didn't have CNN back then. They didn't have people on the screen talking crap, lying to your face, showing you stats that they doctored up on their own. You need to go read about the Holocaust. I've done many reports and stuff on it. I studied it a lot in school because I thought it was just insane that the world let that happen, and we're letting it happen right now. And it is crazy. Maybe that sounds like conspiracy, but who put these numbers together then? Who put these numbers together? Because I didn't put them together. You guys should really question this. If you want to wear a mask because it makes you feel safe, I'm not going to make you feel bad about it. But according to this big gray line, that mask ain't saving anyone. I mean, you could take that as my opinion if you want to. You could say I'm an asshole and I'm starting stuff, but this is their numbers. This ain't my numbers. And you could look it up for yourself. And when you're done looking this up, go read about the Holocaust. Read how the Holocaust started. We're letting them do this to us. And it is trash. That stuff is trash. It is very unfortunate that we're living through this. Yeah, when it comes to politics and a lot of stuff we show, I am unbiased. I'm not playing red team, blue team. I'm here to show everyone the truth. That's all I want to do. I just want people to see for themselves. I want people to read. I want people to go look stuff up and research stuff. You see how easy I pulled this up? You could do that too. It's not difficult. It's not difficult. You can look it up. They put this information right here in front of all of us because they know that we won't read it. They know that we won't look at it. They know that we'll just believe what we see on Facebook, what we believe on the TV, what we believe our friends say, and so on and so on and so on. But Google it. Look it up. It's not hidden. It's not BS. It is right there in front of our face. They're creating reasons for us to hate each other, to divide each other and pick a, that's part of why I'm neutral. You pick a side, every other side hates you automatically. That's the name of the game. That's the name of the game. But this whole COVID stuff, just unbelievable. They're just simply taking our rights away. That's all it is. That's all it is. Now, I don't feel good right now, but do I think I got COVID? No. I don't feel any sicker than I've ever felt at any point in time in my life. Probably should have been wearing a coat outside, right? Like, I don't think I got COVID, right? Do I look like a person that's dying from COVID? No. Like, don't let this stuff fool you. Don't let it distract you from the nonsense. Read into it. See what's up. See what's up. Anyways, thank you guys for being here. Hopefully there's more stuff going on because I'm not done going live for the day. I got more truth to show. So as far as this goes, thank you so much, Angela, for your donation and all your support. You're awesome. You want the link? Yeah, that's a good idea. Thank you. That's a great idea. Look it up yourself. I want you to know that I did not doctor this up. This isn't some crap that I made up. I'm not here to lie to you. That's not what my channel's for. That's not what I'm here doing. I'm not here to lie to people. It's wrong. I've never felt such a calling to stand tall and shine bright. And all of you should too. All of you should too. Think for yourself. Read. Research. Look into everything. And if you feel skeptical if something feels wrong, look into it. If you can't get the information, look up what a FOIA is. It's the Freedom of Information Act. You can get almost anything. You can get police calls. You can get camera footage. You can get anything. And you can file a FOIA on the back of a receipt. You can pull the tag off your underwear and write FOIA on it with a date, and they got like 14 days to comply, or else they committed a federal crime because you have the right to information. Stand tall, shine bright. It's time. It's definitely time. That being said, thank you guys for being here. Sorry it's so dramatic. I live in Michigan. This affects me directly. The COVID nonsense affects all of us. You see the map. It affects all of us. Thank you guys for being here. When I find something else going on, hopefully of lighter heart,